Hi everyone, I'm Dr. Gemmel. I work at Stony Brook. It's so nice to be here. Thanks to our organizers, Bob and Marianne. I've had such nice conversations with them and with all of you. I'm delighted to be here. So I'm going to talk to you today about a clinical trial that we have open at Stony Brook. We have opened it in collaboration with Kinetics, who's running the trial, which it's a phase 2 trial looking at the safety, pharmacokinetics, and dose response of Paltositine in patients with carcinoid syndrome. So briefly, we all know neuroendocrine tumors originate from neuroendocrine cells within the gut, lung, or pancreas. And the clinical presentation and behavior really varies on a spectrum from very indolent cancer to more aggressive types of cancer. All right, we know that most of these tumors express somatostatin receptor type 2 receptors, and therefore our first-line therapies are somatostatin analogs. Now, Paltositine is a first-in-class oral non-peptide somatostatin receptor type 2 agonist, okay? And it's been in clinical development in the endocrine space, so in patients with acromegaly, and only recently has been studied in patients with carcinoid syndrome. All right, so this is an oral tablet, 20 milligrams. It's taken once a day on an empty stomach, and it's given an hour before food and about 6 hours after your last meal, okay? Its half-life is around 40 hours, and from the clinical trials, it looks to be well tolerated. There were no serious adverse events in patients taking it for acromegaly. There were no drug discontinuations due to adverse events, and the most common adverse events reported were headache, fatigue, and paresthesias, and these happen in just over 10% of patients on the trial. So the study schema is as follows. Patients will be screened. The screening period is from 2 to 12 weeks, and then you'll enter the randomization phase, okay? Patients are randomized 1-to-1, 40 milligrams or 80 milligrams for up to 8 weeks, okay? And then there's an open label extension period that goes just short of a year, followed by a safety follow-up that lasts 4 weeks after study drug discontinuation. All right, so the primary objectives, we're looking at safety and tolerability of this medication, pharmacokinetics, and efficacy. So this is measured in symptom control, disease control, and health-related quality of life. So eligible patients, we're looking at patients who are not on treatment, who are treatment naive, and actively symptomatic, patients who are on management, on treatment, and well controlled, those who have documentation of well differentiated, either locally advanced or metastatic neuroendocrine tumor, and no significant disease progression within the last 6 months prior to study entry. All right, so this is our information. I included pictures of our Stony Brook campus. Not sure how many people are out there. And then on the right, our new Phillips Family Cancer Center in Southampton. All right, there's the number to call and the email address for you. Thank you.